Lovely, thank you. My name is Lindsay Forbes. I'm an RDS advisor, and I'm from the Centre for Health Services Studies in the University of Kent, and that's why I'm a RDS advisor for RDS South East. I'm a public health physician by trade, though I work entirely in academia for the moment, though I've been building lots of links with local government public health. I will keep this very quick. So I did look at the attendance list, and I see that there's quite a wide variety of people, many of whom will be extremely familiar with the RDS, but so I decided to make this fairly introductory, because I realize that there will be some people who will not be familiar with the RDS. So the RDS is a bit of NIHR, which is there to support all health and social care practitioners and researchers to develop grant applications. The social care is quite a new thing, and public health research isn't a new, support for public health research isn't a new thing, but it hasn't necessarily been universally comprehensively strong across the country, just because there's been increasing emphasis on public health research in NIHR over the last 10 years. It's a national network, so everywhere in England is covered, and the advice is confidential to anybody and free. So anybody who's any interest in doing research can come and get advice from the RDS. Now the RDS is the advice is delivered by people who are paid for a small amount of their time to do RDS work. Usually a small amount. Some of them are working almost exclusively for the RDS, but they're all practicing researchers, and they have expertise across a range of disciplines and methods. And of course, it was set up at first to give clinical research advice. So there's quite a lot of people who know a lot about trials, for example, clinical trials, but of course, what we need in public health and social care research is a slightly different set of skills. And not every advisor knows everything about all the funding streams or all different kinds of research. And so what we have for when you apply for support from RDS, you will be allocated a lead advisor. So it could be me. And I mean, this morning I had a request for information about the I4I program, innovation, can't remember anyway, it's about technical stuff, which I really don't know very much about. So what I do is I coordinate input from my colleagues across RDS South East to make sure that there's somebody with some expertise. And what the lead advisor does, we'll meet with the researcher, discuss their needs, as I said, coordinate the input, and if necessary, if we can arrange a panel of advisors to advise just before submission, preferably, so that to look at a completed, more or less completed application, and also mock interviews where relevant, particularly for fellowship applications, those are particularly relevant, and some other calls. There are some principles of the way the RDS works. It is intended to be friendly and constructive. So people who really are very, very new to research are very welcome to come and speak to us. It's not intended to be in any way scary. The RDS is meant to be a critical friend, somebody to guide you through things. I would say that, as I've alluded to before, not every RDS expert is an advisor. And of course, we don't have a hotline into the funding programs, particularly, except that we try to keep ourselves aware of developments. We can't say definitely whether something is going to succeed or not. We don't have any influence there, but we can try and help guide you through the process. So it's tailored for individuals. It's, broadly speaking, the support is limited to developing grant applications to NIHR, but lots of other national competitive calls as well. Sorry, I didn't mean to do that. What it isn't really funded to do is do lots of development of research ideas which are never going to be externally funded. However, very often we will be able to provide support to people who just want to discuss their ideas, because who knows, that's where the ideas start, and who knows where it might lead. So we do usually speak to everybody who wants to speak to us, but we can't give massive amount of support to people who are doing internally funded small projects unless there is some appetite to take this further, an appetite and indeed potential to take it further. So this is very brief, and I won't sort of go through this in great detail, but I wanted to make sure that this was there for you in the slide set so that you could refer to it later. So, you know, the RDS advisor will meet and assess needs for support, give some advice on specifics, either themselves or from another member of the RDS team, and will also help exploit networks, so introduce you to collaborators that we know across our patch or indeed nationally. One of a big area of our work is to support public and community engagement and involvement. So again, this is really for reference. Just to kind of give a flavour for the sort of things that we do. You know, we can help, you know, shape the rationale, make it a you know, really precise and compelling bid, help you decide on methods. We can review the application, make sure it's all really clear. We can give advice on other aspects, like all the budgeting and costing, and indeed equality, diversity and inclusion, which is a key, relatively recent compulsory bit of NIHR applications. Just to say again, what RDS doesn't provide is any sort of detailed support for projects where you're not going to be seeking external funding. However, we will obviously discuss those projects because you don't know where they're going to go. They can't actually write your application for you, though they can review it and give you lots of advice on wording, forms of words, that kind of thing. And they can't actually fill in the forms for you or request the costings for you. And they can't support student projects. And the key message I'd like to get across to finish off, this is my last slide, is to say come forward early. So it's okay if your idea is not fully formed. It usually takes months and months and months to develop a fundable application, even if you're working more or less full time on it like we do in academia. And you know, the collaborative writing of the research plan is absolutely essential. It's got to be completely clear to the funding panel. And just to be aware that the actual form filling in and all the bureaucratic bits, as has been alluded to earlier, can be very time consuming. So those are just the key messages to finish off. And if you want to contact your local RDS, that's a link to all the, you know, the one for your area. If you click on that, you can get to the one for your area.